Welcome to Dr. Seema Gulati. She is the Head Nutrition Research Group, Center for Nutrition and Metabolic Research, and National Diabetes, Obesity and Cholesterol Foundation. She is also the Chief Project Officer for Diabetes Foundation India. Over to you, Seema.
I'll be speaking on role of spices in diabetes. We know that type 2 diabetes is rapidly increasing in India due to multiple factors, and predominant among them are dietary and lifestyle transitions. We are consuming processed food and are becoming increasingly sedentary. And not only the prevalence is increasing in India, but we are getting the disease a decade earlier than Europeans. And not only we are getting this disease earlier, but the conversion from pre-diabetes to diabetes is also much higher. In a study conducted in South India, 26% of the subjects with normal glucose tolerance converted to pre-diabetes and another 20% to diabetes.
Dr.
With an
Seema,
yeah?
Can you speak a little louder? It's unclear, that's why. Thank you.
Okay, I'll just... Microphone. Is it better now?
Yes, it's a lot better.
Okay. So, just a minute. So sorry about this. So the etiology of type 2 diabetes has been suggested to be glucotoxicity, lipotoxicity, and inflammation, which lead to insulin resistance and beta cell failure. So we have to target glucotoxicity, lipotoxicity, and inflammation. Because we know that diet is a main cornerstone of diabetes, so we need to identify food items which, if included as a part of healthy diet, can help in preventing the progression to diabetes. So spices are one such food articles. They are dried roots, stems, seed of the plants that are usually grown in tropics. They are used to add flavor, aroma, color, and zest to the food. Now, spices have been suggested to possess anti-glycant, that is, they inhibit the formation of advanced glycation end products, antioxidant, that is, they nullify the effect of reactive oxygen species, anti-inflammatory capacity because of their high content of phenolic compounds. Spices have also been recognized to possess medicinal properties, and they have been used in traditional system of medicine. Role of spices in diabetes needs to be researched because there are very few randomized controlled trials, especially in India. So I'll be just picking up 4 spices, and mainly I'll be talking about cinnamon. So if we look at cinnamon, the major bioactive compound is cinnamaldehyde and A-type procyanidins, so which have hypoglycemic, hypolipidemic, antioxidant, and also potentiate insulin action. They upregulate the expression of GLUT4 and enhance the activity of insulin. Now, second is fenugreek. Again, it has certain bioactive compounds which are responsible for hypoglycemic, antioxidant, and anti-inflammatory effect, increase the secretion of insulin and utilization of glucose in the body. Ginger, again, we have B-type procyanidins, gingerol, shagol, and zerumbone. Again, they have hypoglycemic, anti-diabetic, anti-inflammatory effect. They improve insulin sensitivity, increase the glucose uptake, and protect pancreatic beta cells, and improve glucose intolerance. Turmeric, mainly, it has curcumin, which is anti-diabetic and improves the functions of beta cell. So, coming to cinnamon, we had conducted a double-blind randomized control trial along with Institute of Home Economics. Dr. Sonal Gupta was the lead investigator in this study. What we did, we gave, it was a randomized control trial. The eligible subjects, those who had the metabolic syndrome, were randomized to either the cinnamon arm or the control arm. We recruited about 116 subjects, and those who recruited to cinnamon arm were given 3 grams of cinnamon every day. Like we gave it in the form of capsules, and 2 capsules after every meal, after breakfast, lunch, and dinner. And those who were in the control arm, they were given wheat capsules. Placebo was of wheat flour that was roasted, and then cinnamon essence was added to it, so that the look of both the capsules was similar. So this intervention, along with other diet and lifestyle modification guidelines, was given for 4 months, and after 4 months the subjects were followed up again. And what we noticed at the end of the 4th month, there was improvement in the prevalence of metabolic syndrome in those who were following a cinnamon diet, who were taking cinnamon. What we noticed that there was a significant, this blue bar is for cinnamon group and red bar is for placebo. So there was a significant drop in blood pressure, systolic and diastolic both, and there was a significant drop in fasting blood glucose as compared to the placebo group. There was significant drop in triglyceride, and there was slight improvement in HDL levels and drop in waist circumference as well. Also, we noticed that those who were taking cinnamon capsule, there was a significant improvement in their postprandial glucose levels and in glycosylated hemoglobin. So possibly the mode of action is like inhibition of activity of enzymes that are involved in carbohydrate metabolism, that is alpha amylase and glucosidase, and decrease in production of glucose by the liver, and stimulation of insulin release and action, and lowering of cholesterol by beneficial action on enzymes. So there is one more study on fenugreek that I could found. I mean, it was conducted, the trial was conducted in 2001 by Gupta, and it was a randomized control trial where fenugreek, 1 gram of fenugreek was given along with the glucose drink, and then the blood assessments were done at baseline, 30 minutes, 60 minutes, 90 minutes, and 120 minutes. And it was found that those who were taking fenugreek along with the glucose drink, their area under curve for blood glucose was much lower than those who were not taking. And similarly, the area under curve for insulin was also much lower in subjects who were taking fenugreek and then those who were not taking. So adjunct use of fenugreek seeds improved glycemic control and decreased insulin resistance in mild type 2 diabetes patients. And during the course of the trial, there was no side effect, no adverse effect was seen. So how these spices, what is the mechanism of action? Basically, spices have phenolic compounds. So in the muscle, they increase the AMPK activity, and then it improves the glucose uptake. In the liver, again, the glycogenesis increases, and that balances the glucose levels. And in pancreas, they help in decreasing the inflammatory markers such as TNF-alpha, interleukin 6, or nuclear factor kappa, or reactive oxygen species. Then it helps in reducing the beta cell damage, improves insulin sensitivity, and improves muscle glucose uptake. In adipose tissues also, it improves AMPK activity and improves lipogenesis. And in small intestine, again, it decreases the glucose absorption. So these are the possible mechanism. Of course, we need detailed studies on the effect of specific bioactive compounds on the metabolism. So overall speaking, spices protect RBC integrity, and then they have cholesterol lowering effect, they have antioxidant effect, anti-inflammatory effect, and anti-cancer and anti-diabetic effect, and they are also digestive stimulant. But are all spices, spices all good? Of course, there are certain anti-nutrients which are present in spices, and if we take in excess or for prolonged period of time, it can lead to mouth sores or maybe hepatotoxicity, acidity, different gastrointestinal discomfort. And it has been shown that too much of coumarin in cinnamon can lead to certain types of cancers also, and cinnamaldehyde can lead to allergic reactions because spices can be irritants sometimes, and too much can lead to neurodevelopmental, neurobehavioral, and neuropathological side effects as well. And there is some interaction with drugs also. Although there are not many studies available, but one study shows that fenugreek can interact with warfarin and can increase bleeding. So this is the downside. And then what is the way forward? We need research on the metabolism of bioactive compound in spices to propose a recommendation on dietary intake, and what is the effective dosage and the dietary guidelines, because some studies talk about extract, some studies talk about powdered form, some studies in capsule. So what is the effective dosage? Dose response studies are required, and then understanding the daily intake of spices and the bioavailability of their bioactive compound is a prerequisite to understand the mechanism of their pharmacological effect in the management of diabetes. Now, further investigation needs to be carried out to evaluate the anti-diabetic benefit of single phenolic compound present in the spices to clarify the exact mechanism, because when we are consuming spices, we are consuming as whole. We don't know what compound is acting. So if extracts are taken out, which extract will work in which direction, that needs to be researched. And of course, caution should be taken for the indiscriminate use of spices. We know people who are taking, fenugreek every day for many years, indiscriminately. And then, people are starting their day with the cumin water, and they keep on taking for several months. So caution should be taken. Spices should be taken as spices, and if we have a particular target, then it should be for a short period of time. So adding spice to our life may serve as delicious and sensible way to healthy body. Spices are rich in antioxidant compounds and have potential pharmacological effect in the management of diabetes, but of course indiscriminate use should be avoided, and more research is required on the effective dosage and bioactive compound in the spices. Thank you.
Thank you very much, Seema, for that interesting talk on spices.